This is a community analysis of Pinellas Park, Florida, presented by Sabina Balic, Ayla Evans, and Susa Hanks. Here are two maps showing the location of Pinellas Park in relation to Florida. In 1908, world-renowned Philadelphia publisher F.A. Davis bought 22 square miles of underdeveloped pine forest, now known as Pinellas Park. As a wealthy publisher, F.A. Davis used his Philadelphia newspaper to advertise affordable Pinellas Park land ownership to families of moderate means who were seeking Florida's milder climate. From 1908 to 1917, Pinellas Park enjoyed 8 years of highly profitable sugarcane crops and experienced fast-track economic growth, building a foundation for a thriving, self-sufficient community. By 1950, the census experienced a growth rate of 500% in one decade. The 2014 census reports an estimated 50,946 residents who call Pinellas Park home. Structurally, Pinellas Park meets the needs of the residents and is easily navigated with a numbered avenues and roads system, with Park Boulevard providing a unique main road access to meet the needs of both the residential and business communities. Compared with other Pinellas County communities, our windshield survey reflects the predominance of low middle income and middle income residents. The majority of single-story cinder block homes and mobile homes present with non-manicured lawns, little foliage or flowers, older roofs, and economy cars in driveways. Again, F.A. Davis originally promoted Pinellas Park as an affordable Florida home for the family of moderate means.
With 25% of Pinellas Park's population greater than 60 years old, there comes an increased risk for heart disease with this aging population. There are more seniors in Pinellas Park as compared to Florida, creating additional needs for assisted living facilities, nursing homes, urgent care clinics, and home health care. Approximately 20% of Pinellas Park's population are under 19 and school-aged, creating a need for community nurses to provide education regarding obesity and healthy food choices. 10% of Pinellas Park population is Hispanic, with a growing Asian population, which will increase the need for bilingual nurses and interpreters. Regarding education, Pinellas Park has a lower percentage of college-level educated residents, posing a potential issue. According to the CDC, people with higher education levels and higher income levels have lower rates of chronic diseases. Chlamydia and gonorrhea are primary communicable diseases for Pinellas County, and leading causes of death are heart disease and cancer. Perceptions of health risks are important when dealing with STDs because many infections are asymptomatic. As many as 70% of people engaging in high-risk behaviors view themselves as low risk. This is a huge issue. As a community health nurse, education needs to be reinforced to meet the health literacy needs of the community. One random control trial published in the American Journal of Public Health showed that community-based organizations had success with reduction in high-risk behaviors. As community health nurses, we have the opportunity to intervene through primary prevention by educating our community about healthy and unhealthy behaviors.
Our analysis revealed the need for a low or no-cost after-hours clinic, a key focus since existing clinics have limited hours. An after-hours facility would decrease Northside's strained overflow and encourage people to seek secondary care earlier at a lesser cost. Our analysis also determined that a 24-hour for-profit clinic was not the answer, since Pinellas Park's low to middle income residents often cannot afford required copays. We did not feel that accessibility was an issue at this time. Regarding Healthy People 2020 goals, our 3 community objectives and outcome measures would be 1. Improve health outcomes by reducing smoking, STDs, and obesity. 2. Deliver and monitor the outcomes of more effective health services by working with city managers to open an after-hours clinic. And 3. Focus on healthcare literacy, especially among Pinellas Park's Asian community who have an increased presence at Northside Hospital. An intervention would be partnering with influential Asian leaders to help educate this population on preventative care. The overall Healthy People 2020 focus would be on primary preventative care versus problem-focused care, requiring secondary and tertiary strategies. There will always be a need for additional mental health facilities in this low to middle income community. With Pinellas Park receiving its water from a shared Pinellas County network, our group felt that water quality results should be published more frequently than once a year. At this time, the 2015 water quality results are still pending. Sewage management is adequate at this time. However, regarding air quality, Florida, Louisiana, and Texas currently have the highest pollen count nationwide. Although pollen count is published daily in the newspaper, Pinellas Park could use its electronic billboard at 49th and Park Boulevard or partner with local drug chains who own electronic signs to promote the daily pollen count and direct residents to emergency walk-in breathing treatment centers if necessary. To better serve seniors, vulnerable populations, and the growing Asian community, Pinellas Park could better promote evacuation routes for emergencies and, when necessary, mosquito control for larviciding and source reduction. One idea is to set up education booths at population-specific gathering places or events and provide brochures and education on evacuation routes for emergency and hurricane preparedness. Asian language brochures should be a priority. Although mobile vehicles similar to blood bank buses would be optimal, the cost is unrealistic.
City Council of Pinellas Park consists of mayor and 4 council members. Both of these positions are elected by Pinellas Park voters. Office terms of mayor is 2-year, council members 4. City manager, on the other hand, is appointed by City Council. His responsibility are preparation of annual city budget and enforcement and execution of all City Council laws. City clerk is appointed position as well. It serves as a service department to all other government departments as well to general public. City Council holds council meetings every other Thursday at 7:30 p.m. It is open to public and members of the community are welcome to express their concerns for anything going on in the community. Video of the meetings are readily available on the city's website. A regular citizen can arrange meetings with officials, and email conversation is answered promptly in 1 business day. What raised the concern and question is new increase in property taxes and prices of plain water that will fall on the community's shoulder. Regarding deficit in the budget, officials stated it is planned every year and does not mean debt, which would be accumulation of deficit through the year. We're going to prioritize community needs. According to U.S. Census 2014, 21% of Pinellas Park population is uninsured, from which last insured are employed and people from age 19 and 25, which is above state average. Problem with that is these people are most likely one who will not receive the care. Community official and health department can play a crucial role in organizing free screening and education. There's also a need for 24-hour urgent care to avoid overcrowding the only hospital in Pinellas Park. Heart disease is a leading cause of death. 1/4 of community population die of the heart causes. Modifiable factors continue to be an issue for Pinellas Park population. Some of Healthy People 2020 objectives are to increase number of people who measure their blood pressure in time frame of 2 years and can identify blood pressure if it's low, normal, or high. Decrease the number of people with high blood pressure or increase a proportion of population who are willing to make lifestyle changes to lower cholesterol or to take cholesterol medication. Obesity is another concern in Pinellas Park, as well as of the country itself and the whole nation. Numbers speak for themselves. There is overall 65.1% adults with unhealthy weight in Pinellas County. One of the objectives of Healthy People 2020 is to increase variety of vegetable consumption in diet for 2 years old and older. With high number of families living below poverty line, that can be difficult sometimes. But by educating to look for affordable sources like Free Market just outside of Pinellas Park, that problem can be resolved. Healthy People 2020 also suggests reducing intake of calories from solid fats and added sugars. Number of fast food restaurants located just inside of territory of Pinellas Park with affordable meal prices is a problem. Community nurse can educate population on healthy eating to decrease risk of chronic diseases. Population of Pinellas Park is aging. According to U.S. Census, there is a 39.1% of population older than 50. Overall, American society is getting older. The higher increase in old population is expected from 2010 to 2030. To be said, with the aging population, there is a more need for healthcare services due to chronic disease, age carry with itself, increased need for assisted living and skilled nursing facilities, and there will be additional burden on family members who will take care of the loved ones. When driving through the neighborhood, you can see many people smoking while on the street, in a parking lot of Northside Hospital, near the cemetery, while driving in a car with other passengers. Statistics speaks for itself. Complication that this habit is huge, from heart disease to cancer, secondhand exposure. Community needs to be educated about the complication as well as smoking cessation. Pinellas Health Department has initiative to help and works closely on making policies to prevent young people to be exposed. Website is good source as well as phone number available for assistance for those ready to quit. Sexually transmitted diseases are on the rise since 2001. We should see opposite effects. But due to health disparities, lack of education, and stigma, these numbers are on the rise. Healthy People 2020 objectives are reducing the number of people affected with the disease by educating those at risk, correlating with health department, which already has resources available for screening and treatment, plus it's confidential. Teaching safe sex all ages to prevent spread of infection. As previously mentioned, Pinellas Park community's disparities lays in a high number of families living below poverty line, higher number of unemployment, higher number of population without health insurance, which consequently leads to difficulties to access to healthcare services. Globally, there is 1 billion of people without access to healthcare. 64.28% of all deaths worldwide are caused by non-communicable diseases such as cardiovascular disease, cancer, diabetes, and COPD. Many African countries go through struggle with disparities, but some of them bring good example by initiating projects like in South Africa, Project Misaluluke, which is a mobile clinic that offers education, screening, and raising HIV and AIDS awareness to its citizens. Pinellas County Department, on the other hand, provide extended services to Pinellas Park community. To keep Pinellas Park community healthy, city officials can be more efficient in promoting preventative care and working together with healthcare department. Frequent mobile clinic screening can be arranged for its particular population.
Please see attached Word document for our references.